Hi, my name is Jennifer Sorensen, and I am presenting an oral presentation on CPR for infants. As we all know, accidents can happen at a moment's notice, and I know this because I have two beautiful children of my own. I have a 4-year-old son and a 6-month-old daughter, and this is why I chose to become first aid, CPR, and AED certified, and you can too. Today, cardiovascular disease remains the leading cause of death around the world. So after watching my presentation, you will have learned the key guidelines that are essential for saving an infant's life. A few main points I have put together include how to recognize an infant that is not breathing, and to gain the confidence needed to help an infant if they do need CPR. You never know, someday you may have to save someone in your own family. So I'll start by explaining what CPR is. CPR stands for cardiopulmonary resuscitation, and cardio stands for heart, pulmonary stands for lungs, and resuscitation means to bring back to life. If a person's heart should stop or fibrillate, irreversible brain damage may occur within 4 to 6 minutes. This is due to the inability of the oxygenated blood to reach the brain. There is a critical period before emergency personnel arrive to the scene, and you are the crucial link to the survival of that patient. Your immediate actions can make the difference between whether a person lives or dies. All CPR is giving rescue breaths to fill the lungs with oxygen, and that's also combined with forceful compressions to the chest to send the oxygen in the blood to the brain and all other important major organs. Now you might be wondering how you are supposed to know or recognize when an infant is not breathing or needs help. It is uncommon for an infant's heart to just stop working, but they can be born with a congestive heart problem. Most often, an infant will be choking on food or a small object. This blocks the airway and stops them from breathing, therefore they become unconscious and need to be given CPR. If you encounter an infant who appears to be choking or is unconscious, you must act quickly to clear the obstructed airway so the infant can breathe. You may not be able to call out, they may not be able to call out or cry, or the worst case scenario would be to breathe. Not breathing means you do not feel air coming from their mouth when you reach over their mouth, and you do not see the chest rise and fall, which indicates breathing. Okay, if a baby is coughing, it means that she is getting air, so you want to let them cough, and hopefully they forcefully cough the object out. And if she's crying, you want to assume that she is getting air and breathing. Anytime you're in doubt, perform CPR. Next, I'm going to explain the steps that you need to give an infant CPR. First off, you want to check the scene. You are no good to the victim if you are hurt yourself. And sometimes all you can do is nothing at all. Check for responsiveness. So when you come to baby, you want to spend no more than 10 seconds checking the pulse, and babies you want to check the brachial pulse or on the leg. If baby does have a pulse, you want to just give them rescue breaths every 5 to 6 seconds until other help arrives. If baby is choking, you want to look into their mouth to see if you can see the object. If you see it, you would want to do a side sweep to get that object out. If you don't see an object, you can give a rescue breath by covering the mouth and the nose of the baby and blowing. And if you notice the chest rise and fall, then the airway is not obstructed. But if you do not see the chest rise and fall, there's most likely an obstruction to the airway. And then you must begin compressions immediately. You never want to blind sweep for an object out of a baby's mouth or anyone's. And you then would proceed into giving the baby 5 back blows followed by 5 chest compressions. So I will demonstrate that really quick. And again, this is for a baby who is choking. You encounter the baby, you clearly see that they are choking, so either their mouth is open, they are not coughing, not crying, they may even be unconscious. So I will check baby and carefully turn them over. You want to start with back blows, and you forcefully, I prefer to sit on a chair when I practice. It's a lot easier. You have to have their head below their chest so that gravity can do its work and pull the object out. And you want to give 5 back blows. 4, 5. And then immediately and gently switch baby over and use your 2 fingers, center of chest, and 1, 2, 3, 4, 5. Now that was for a choking infant. If you do not see a pulse or a response when you come to the scene and you don't know if baby was choking, then you must request that someone go call 911 and get an AED immediately. It's important to point to that person directly in their eyes and say, "Hey, you, go call 911 and get an AED." And it has been proven that the quicker we call 911, the greater the survival rate of the patient. And calling 911 will not delay EMS from getting to the scene. One important note for infants only is if you are alone, it is recommended to perform CPR for 2 minutes before calling 911. Then continue CPR until the baby cries or until other help, EMS, or the AED arrives. If baby does not respond after 2 minutes, it's okay to pick up baby and go to the phone or find someone else to call 911. Now for the CABs of CPR, which, if you're familiar, has changed from the ABCs of CPR, which was used in the past. So C stands for compressions, and when you are performing on an infant, a child, or an adult, you want to push fast and hard with your pointer and index finger for infants, and children and adults are different. You use your palm. And you want to give 30 compressions. You must push at a rate of 100 compressions per minute at a depth of at least 1 to 1.5 inches down into their chest, and allow the chest to completely recoil after each compression. You would proceed to do 30 compressions. And then airway, so A stands for airway, and you want to open baby's airway so that when you give a rescue breath, it's going to go down into their lungs. And you can do this by doing the head tilt chin lift technique. B, so B stands for give 2 rescue breaths by placing your mouth over the infant's nose and mouth. And you can either plug their nose and go over their mouth or put it over both. And you want to be careful not to put too much air or pressure into the blows. Babies are very small. And you don't want baby to puke on you either. Lastly, defibrillation, or AED, you may have heard of, stands for Automated External Defibrillator. As soon as the AED arrives, immediately place it into operation, turn it on, and it will prompt you exactly what to do. You do want to minimize interruptions and compressions as much as possible. I would like to conclude my presentation with a strong recommendation that you and everyone you love consider CPR training to become certified. If you find yourself in a situation like this, it can be frightening and may cause you to go into panic mode. This can prevent you from being able to think straight or do the right actions. In this kind of situation, it is best that you at least push on the chest fast and hard. This has been referred to as maybe compression-only CPR, you might have heard of. And this is way better than no CPR at all. I hope I have helped you to better understand when it's necessary to give an infant CPR, along with how to completely perform infant CPR. Thank you.